All right, well, thanks for coming out today. And like she said, my name's Jamie Smith. I'm a cancer control specialist with the Kentucky Cancer Program, and we're a state-funded program through the General Assembly, and we're administered on the western side of the state through the University of Louisville's Brown Cancer Center, and on the eastern side through UK's Markey Cancer Center. So technically, I'm a University of Louisville employee, and but I do have an office in Paducah, and I cover the far 8 western counties in Kentucky, the Purchase area. So like she said, we're going to talk about breast cancer, and we'll talk a little bit about some statistics, and some of these are going to include some of the men, like she mentioned. Of course, the majority of women are at a higher risk for breast cancer, and each year the American Cancer Society estimates the number of cases of each type of cancer we'll see. And for breast cancer, they estimate a little over 232,000 women in the U.S. will be diagnosed, and a little bit over 2,200 men will be diagnosed in the U.S. So in Kentucky, we'll have about 3,300 women and 590 men. So it's not a huge amount of men, but still, there's 120 counties in Kentucky, so that's more than one man per county. And then when we look at the opposite side of that, that was incidence. When we look at mortalities, the number of deaths that we see from breast cancer in the U.S., a little bit over 39,500 women will die, and it's not 590 men. It's not 590 men diagnosed and 590 men. That statistic is wrong. We need to change that. It is less than that. So I'll fix that. And there's over 2 million women survivors living in the U.S. today. Women have a 1 in 8 chance of getting breast cancer, and men have a 1 in 769 chance. So your odds are pretty good that you're never going to have breast cancer, but there still is a small chance. And then women have a 1 in 36 chance from dying, and men, you all have a 1 in 3,333 chance of dying from breast cancer. So makes you feel pretty good, right? All right.
Is the risk higher? I'm old buddy, and I'll ask a question. Is the risk higher in men if somebody else in their family has cancer or breast cancer?
If the genetic gene is, which we'll talk about in just a little bit about that. Yeah. So a lot of times we tell women that, they can do a self-breast exam. Men, you all can do that as well. Obviously, I don't expect you all to sit there and do that every month like women do. But you all should be familiar with what's normal and what's not normal, okay? If you were to find a lump in your breast or around the breast tissue, then you would obviously want to tell your doctor about that. And yes, you would have to get a mammogram for them to be able to tell, or they would do an ultrasound on a man to be able to find what they have. So it's the same for any women that you know as well. And then women go to the doctor every year, and there's a health professional, either their doctor, nurse practitioner, somebody that will do a clinical breast exam on them every year. And so that's where they feel for any sort of lumps or abnormalities in the breast. And usually they are highly trained, so they can find a lump at a much smaller size than what a woman might find on her own if she were to just do a self-breast exam at home. So again, this should be done annually. So should women get regular mammograms? The answer is yes. There's lots of topic out there as to whether women should or shouldn't and what age they should start. The American Cancer Society still says age 40. The United States Preventive Task Force says 50. So at least by the age of 50, a woman should have a mammogram. If there's a family history, then they would need to start earlier than that. But mammograms should be done every 1 to 2 years, and obviously you guys don't have to go get mammograms, but you all get to do other fun stuff that we don't have to do. You need to talk to your, like she said, your women in your life and make sure that they are getting their screenings done. Then you need to tell the doctor if you know there's a family history of breast cancer in your family, then the screening will begin before age 40. It would probably begin depending on when there was a diagnosis in your family. If a lot of women are diagnosed at a young age, then, we've seen women as early as in their teens starting to get mammograms. So it just kind of depends on what age the diagnosis is in the family. So when women usually go to have a mammogram, some people say they feel pressure and discomfort. They need to be careful when they schedule their mammograms because it could be a little bit more tender. And if they're on hormone therapy, it can also make their breasts more tender. Some reasons why women don't go mammograms, sometimes they're scared. Cost is an issue, but the one thing is now insurance is really good at paying for that, and it should be on most insurances now completely covered. Accessibility is an issue, but for us, it's not really that big of an issue because of course, Paducah has several locations. Marshall County has a location. I mean, there's locations around us to be able to get the screenings done. Lack of knowledge, again, not a huge issue here, but still people do sometimes not know that the screening is required or should be. It's not necessarily required, but suggested. And then negative mammograms in the past. A lot of times people think if they've had one mammogram and it was negative, then they don't have to worry about having another one. And that's simply not true. And then not enough time. Sometimes women will put everybody else first. They worry about where they're going to take the kids, making sure that the husbands, they'll nag you all day to go to the doctor, right? But sometimes we don't go. And so they worry about everybody else, and then they put themselves last. And so sometimes that just gets put on the back burner. And then some people think they don't have a family history of breast cancer, so they shouldn't worry about it. Well, isn't that nice little effect they put there? So what are some risk factors for breast cancer? Gender, obviously we talked about that earlier. Women are at a higher risk than men, but men can still apparently get breast cancer. Age, the older we are, the more likely we are to get cancer. And that's typical of any cancer. Just the older we are, the more likely a gene's going to go bad, another gene's going to go bad, and we're going to develop cancer of some sort, okay? Genetic risk factors. So we know that there are 2 genetic genes for breast cancer. It's BRCA1 and BRCA2. If you have BRCA1 or BRCA2, then it does put you at a higher risk for breast cancer. It also puts you at a higher risk for ovarian cancer if you're a female. It also puts you at a higher risk for prostate cancer if you're a male. If you do have that BRCA gene in your family, a man is more likely to get breast cancer with that gene, okay? So there's a test that can be done. So if any women have it in your family, then there's a great chance that you carry that gene as well. You can be tested for that as well, okay? And what they usually do is they find the one person that's been diagnosed with breast cancer first. They're screened for the genetic gene. Once it's found, then they can screen the rest of the people in the family for that one gene. The first person that gets screened, it's about $3,000 to get screened for breast cancer to find out if that gene runs in the family. Once they determine what gene that is, then it's $300 just to screen for that one gene and the rest of the family members. So a lot of times what people do, so they're not tainted by insurance because they're not supposed to be tainted, but you know how sometimes it is. The one survivor will go ahead and get the screening, and then they pay the $300 under the table for the other members in the family, so that if they don't have the gene, it's never flagged in their system at all as to that they were testing for that gene, okay? There's only one company in the United States that does genetic testing, so all of those genetic tests are housed under one facility. So as they find new genes, they're able to go back and they can go back and do more studies to find out if there's new genes that they maybe didn't find in people before. So I've been told that they're in the works of finding BRCA gene 3 and BRCA gene 4. So right now we know of 2, but obviously we may see more in the future. So a family history of breast cancer, which we talked about, the personal history of breast cancer, a lot of times, and it depends on what type of breast cancer that one might have, but there is a chance for a reoccurrence of that same type of breast cancer in the same breast or in the other breast. And usually doctors can talk to you about that, and women make the decision, and men can make the decision on whether they want to have one breast removed or 2 breasts removed, and a lot of that has to do with the personal history and the type of breast cancer that you have. Race can play an issue, and what we've seen is that African Americans are at a higher risk for breast cancer. We've also noticed that a lot of their breast cancers are found at later stages. And a lot of reasoning behind that is because of screening. We have lower screening rates in African Americans than we do Caucasians. So not having children puts you at a higher risk of, or having them late in life. And they say that that means after the age of 30, that can put you at a higher risk. Having birth control pills, and they say anywhere from like 10 years longer to 15 or more years of use of birth control pills puts you at a higher risk for breast cancer. And alcohol, obesity, exercise. Again, that's with every cancer out there. Any of those kinds of behaviors can put you at a higher risk. Alcohol for men, no more than 2 alcoholic drinks per day, and for women, no more than 1 is the suggested recommendation to decrease your risk. And then obesity, obviously increasing exercise each day up to 30 minutes a day of high intensity workout is what we want. And then eating a low-fat diet, limiting the red meat that you eat, eating a high fiber, all that good stuff that everybody comes in here and talks to you, I'm sure, at every education session. And then on the opposite side of that, too, I will say that if you know of any women that have breastfed, that decreases their risk for breast cancer. So breastfeeding decreases your risk, yep. So where can you go, or where can you send somebody to get a mammogram or a clinical breast exam? Obviously, we talked about healthcare providers, the health department. If you know of anybody that doesn't have insurance, we do have a Kentucky Women's Cancer Screening Program where they can go and they can get a pap smear even to test for cervical cancer, but they can receive the clinical breast exam and the mammogram. And then if they were to find out that they did have precancerous or a cancerous condition, they would then pick up Kentucky Medicaid through the Kentucky Women's Cancer Screening Program that would pay for treatment for those ladies. And then the mammography facilities, which there's 3 in Paducah, and then there's also 1 here in Marshall County. So we talk about some lump sizes, and I told you a little bit earlier about, doing the self-breast exam. So if a woman were to do a self-breast exam every month, that top would be like about the size of a lump a woman would find in her breast. Then if she just kind of did it sporadically, not if she did it every month. The next one is if she did her monthly self-breast exam every month. The middle one is one that a clinician would find during the clinical breast exam. Then the second to last is the one that's found on the first mammogram. And then if women would go and have a mammogram done every year, you could find a cancer that small. And it can be smaller too. They found it much smaller than that, but just on average. So the moral of the story is you would much rather find a breast cancer at that very small stage than at a larger stage, okay? I've known some women that have found lumps in their breasts that are the size of grapefruits, and that's definitely not a size you want to find in your breast.